Hey guys, this is Teresa. Sorry it's this way, but I'm not tech savvy and I figured it would be better to see a PowerPoint than to see me. I wish this was my first attempt, but it's definitely not. I've messed up a few times with my words, like 5-10 minutes in, and then I got frustrated and so I had to start over, or I filmed it literally the wrong way and so I went to upload it, and then when I uploaded finally, it was like a small little sliver and I was like, oh my gosh, I filmed it the wrong way. So here we are. But I chose to do antibiotic resistance. I want to do something that we see in the clinical setting, but we might not talk about as much or be as knowledgeable on. So what's the problem? Antibiotic and antimicrobial resistance is an urgent problem that is causing challenges to the healthcare system and challenges in treating patients. So what competencies are we looking at? I chose evidence-based practice because this is definitely something that we need to have rationales and have research and knowledge of treating these types of patients. And then I chose safety because the safety of the patient and then also the safety of the healthcare professionals working with them. But this is definitely a big thing for infection control and treating properly, because if not treated properly, it could gather complications and actually could be life-threatening. And then informatics, statistical research and doing studies and being informative and educating our workers and students on this is very important to reduce the problem. So antibiotic resistance occurs when bacteria change in response to the use of these medicines. These bacteria may infect humans and animals, and the infections then are harder to treat than those that would be non-resistant. So I just thought that was kind of interesting that it pointed out animals, because I was kind of looking at this from a one-track view of just humans, but also animals. This plays a problem with them as well. And so there were actually several studies when I was looking up articles on with veterinarians and testing animals and for this, and actually I found some kind of interesting, so I read a few. But antibiotic resistance leads to higher medical costs, prolonged hospital stays, and increased mortality. So obviously patient care and the patient safety is number one, so we definitely want to reduce the amount of mortality here, but also alongside that there are higher medical costs and prolonged hospital stays with this. So with higher medical costs, this will be costing the patients more money because of prolonged treatment, or costing the hospitals money, which we definitely could be using that money somewhere else if this is a preventative thing. And then prolonged hospital stays, I mean, one, nobody likes to be in the hospital, and two, that patient having to stay in the hospital longer, like say a floor is full, then there could be a patient that needs that person's room, but because of this complication, they're having to stay longer and that other patient can't get in. So the world urgently needs to change the way it prescribes and uses antibiotics. Even if new medicines are developed, without behavior change, antibiotic resistance will remain a major threat. And some of these changes that they were talking about could be like vaccines, hand washing, practicing safer sex, good food hygiene, so kind of infection control, which we've talked about for so long, so everybody knows pretty much about that. Resistance to antimicrobials can be through genetic mutations or the transfer of resistant genes from other bacteria. So in some of the articles I was reading, when they were like studying the knowledge of students or healthcare workers on antimicrobial resistance, this was definitely an area that people were lacking knowledge, because genetics are confusing, like unless you're in the field of genetics and mutations. Like even when I was reading some of the articles that were focusing on the genetics of it, it's very confusing. And so like I didn't even put that much in here because I didn't even know how to explain it. But it is something that we need to be knowledgeable of, because it does play a pretty big role of the resistance. Bacteria use several mechanisms to become resistant to antibiotics, and for example, like to a discrete class such as penicillins. So for example, MRSA is resistant to penicillins, so anything in that class, it's not going to be able to treat the MRSA. It is reported that if resistance continues, deaths attributed to antimicrobial resistance could reach 10 million by 2050. So this was in one journal I was reading, and with doing their studies, they predicted that number. And that's a pretty big number, so that considering all those deaths would be attributed to this resistance, I would definitely say this is a pretty big issue that we should be teaching on and trying to reduce these numbers. And then in that same article, it said approximately 80% of antibiotics are prescribed in the primary care setting for self-limiting viral infections, such as the cold or a flu. Which leads to inappropriate prescribing, which is widespread. So the problem with inappropriate prescribing or like misdiagnosis, giving these patients antibiotics when they don't need it, can be misuse of it and can actually lead to resistance later on. And not to mention, I mean, we're not treating them properly then, and that's going to also lead into the prolonged stay or more money being spent. So factors contributing to that: patient-prescriber relationship, so the patient's expectations could affect the physician's prescribing, previous experience of being prescribed antibiotics, or time restrictions. So this said that 44% of general practitioners confess to prescribing antibiotics to get a patient to leave surgery. So this is basically saying that like time can also affect the prescribing of it. So for example, yes, we want to prevent infection, but if these patients don't need antibiotics, we don't need to just quickly, oh, let's give them antibiotics and get them going, like just to push them on and save time. We definitely need to have like a rationale and evidence-based practice behind it. So it is estimated that the annual cost of this problem in healthcare systems in the U.S. is $21 to $34 billion. So that's a lot of money annually that we're spending on this. And then it is estimated that every year billions of patients get affected by this. So despite the efforts of the hospitals to improve the caring process and health of the patient, infections still occur with a higher frequency. So we're still not controlling the infections because the numbers are still going up. The rise of healthcare-associated infections caused by this antimicrobial resistance increases morbidity and mortality in hospitals around the world. They're associated, then that's talking about like associating the economic effects in the institutions and health systems as well. So the healthcare-associated infections are still occurring. It is estimated that 70% of the world's bacteria have developed resistance to antibiotics. This was this one article I was looking up. And if you think about all the bacteria in the world, that is a lot, like 70%. But then also if you look at it, 30% is still a pretty big number that haven't. But 70% is a pretty big number. And factors contributing to that: the emergence and spread of new resistant mechanisms, failure to identify new antimicrobials in the last 30 years, so not identifying these new ones that are coming up, overuse and misuse of antimicrobial drugs, which I touched on, and then ineffective infection prevention and control, and then poor sanitation and hygiene. So those last two we've talked about a lot. And then with the reduced number of effective antibiotics, treatable conditions can become life-threatening. That's what I was talking about with complications. In order to minimize this resistance, we need to use antibiotic stewardship. So this could mean like promoting healthy lifestyles, infection control, compliance with antibiotic treatment, educating patients and families, and collaborating with other healthcare professionals with the care. Teaching aspects: antibiotics don't work against the flu or colds. Always finish course of treatment. Like some patients here, a big problem patients are taking antibiotics for an infection, so they start to feel better, so they stop taking their antibiotics. Then the infection is not completely treated, and so it's just going to come back, so they could either be prescribed the same antibiotics again or another antibiotic to treat that infection that came back, and this increases the risk for resistance. Do not share antibiotics. So in some of the journal articles, people confess that like they shared antibiotics with other people in their household, or they took leftover antibiotics, and that's not good either. And then this last, you should ask a pharmacist or healthcare provider if you have questions. And that's a big thing to promote, is like don't make people feel stupid for having questions. Like definitely encouraging questions. So this other article was on the knowledge, beliefs, and practices. So nurses are the main communication link for hospitalized patients, and they play a crucial role in preventing the spread of antibiotic-resistant bacteria through the stewardship we were just talking about in the last article, and infection control. This requires nurses to possess knowledge and the correct attitudes towards this problem. So a study was carried out to identify the level of knowledge that they have among student nurses. So it was a descriptive cross-sectional study, and it was a questionnaire among 199 students. And so the study cohort had a mean knowledge score of 71.9%, which was a pretty good number, but close to 40% believe that taking antibiotics will help to prevent a cold from worsening and make recovery faster. So they're just putting in the article like that number shows that like the misprescribing of antibiotics can definitely still be a problem that people aren't really understanding when to prescribe them and when to not. Infection control was identified as the main method that nurses can engage in preventing antibiotic resistance. So that's obviously big. So another article was also kind of on the similar thing. It was another study done through July to October 2018, and this was also a questionnaire, but this was for students that were going to study to become doctors. And so there was 474 responses in this study, and this was over 103 different medical colleges. And so once again, their knowledge score was good, like the overall knowledge of it. 83.3% students had reported that they had consumed antibiotics in the previous year. 28.7% were using leftovers antibiotics in the future without consulting the doctor. So that's kind of big, because even like they might think that they know what's best because of them being like a medical student or something, but they're taking leftover antibiotics without talking to a doctor, and so that could also increase their resistance. 8.9% of students reported that prescribing antibiotics over the phone is good patient care since it can save time. So I thought that was just interesting, because they were talking about how they don't agree with that. But right now, obviously, especially like telemedicine is becoming huge, and so like it's easier, it's you don't have to go in, and it seems so convenient. But honestly, it can lead to like misdiagnosis, misprescribing, and this can cause this problem to increase. So overall, the knowledge of the students was quite satisfactory, but these students are going to be primary care physicians, so it's very important that they know the situation with this problem and have the knowledge related to use and rationale, prescription of the antibiotics. Like, we don't want to just prescribe people when they don't need that. So this was another study done about resistance and consumption in Mexico. So they took blood and urine tests, and then they defined the daily dose consumption of antibiotics over like how many occupied beds in the hospital. So of 4,382 blood isolates, E. coli and Klebsiella pneumoniae were most frequently reported, with an antimicrobial resistance greater than 30% for most drugs. Resistance to oxacillin and Staph aureus was 20%, and then from 12,151 of the urine, 90% corresponded to E. coli. Resistance to Cipro, cephalosporins, and sulfamethoxazole was greater than 50%, with good susceptibility to nitrofurantoin, amikacin, and carbapenems. But the global median antimicrobial consumption was 57.2 of that daily dose consumption over 100. So here you're probably not going to be able to see it. I mean, I can try to zoom in, but here are some numbers to resistance. For example, like Cipro is a common one we see. The number of resistant strains is 279, clindamycin 325, and this is for staph. And then rifampin only 34, so that's definitely one we're going to see a lot because it's less resistant. And then vancomycin, only 3 number resistant strains. And then over here we have the E. coli and Klebsiella. So ampicillin, I know we talk about that, number of resistant strains, 8,734. And then, let's see another one. Cipro down there for that one, it's 7,105. Meropenem, 155. So I thought that was just like interesting to see in their little study the amount of resistant strains in that to these infections. So for a case example, so I obviously have seen many patients with MRSA, and so I guess that's kind of what got me thinking. And so like a typical treatment example would be like clindamycin and a combination of rifampin. But I know like in one patient in particular, I remember the nurse telling me, like, he wasn't even my main focal patient, so I didn't have all his information, but I remember her telling me that the MRSA was in his bloodstream, So therefore, you had to be on droplet precautions because you didn't want to transfer that over to you. In 2008, about 86% of all invasive MRSA infections in the U.S. were healthcare associated. I just added in that statistic because that is a really big statistic. I know it was in 2008, so I'd be interested to research what it is now. But that obviously is meaning that they are getting it in the healthcare system, and instead of being community acquired. Sorry, I'm trying to fix this because it looks blurry. There. But so typical treatment for like MRSA would be a 7 to 10 day of antibiotic treatment, but it can be longer. For example, if these complications that I was talking about arise, like for some of the complications of MRSA could include infection of heart valves, death of soft tissue or bone and joint infection. So in these patients, we definitely want to treat them properly and accordingly to what they need. For example, penicillin and amoxicillin, they're not going to treat MRSA. I kind of talked about that earlier. So those are the strains that are resistant to that. So yeah, I guess that kind of counts as a case example. But in conclusion, the World Health Organization labeled Global Action Plan on Antimicrobial Resistance and having 5 strategic objectives. So we want to improve the awareness and understanding of antimicrobial resistance, strengthen surveillance and research, reduce the incidence of infection, optimize the use of antimicrobial medicines, and ensure sustainable investment in countering antimicrobial resistance. And I felt like those strategic things basically summed up everything I said. So I thought that was a good point just to end on. And yeah.